doing a new rule to formally create a fertility benefit option for employers that can be offered to all employees outside of their normal health insurance plans. It's a big deal. They were not properly taken care of. Katie Britt knows that better than anybody.
That's right, sir.
Who called me and said, I must say I shouldn't admit this, but the first time I really heard about the fertility was through Katie. She said, sir, we have to do something. And I'm a quick study, so I learned everything there is to learn in about 3-4 minutes. And,
That's right.
and I became the father of fertility.
That is true.
No, it just made a lot of sense to me. She explained it well. And I hope you tell that story, what happened to you, that you were virtually attacked with a bad ruling from a court. They gave a very bad ruling, as you remember, in Alabama.
Yeah, but you stepped in and saved the day and made sure that we had nationwide access to IVF, and have done so much since then, and we are so grateful.
We had something passed within 2 days after
That's
that.
right.
So
That's
it was
exactly
really pretty
right.
amazing. You don't see that happen very often. But this will be supplemental option available to those who need it, much like vision or dental insurance. So we're bringing it right down into the mainstream. By offering coverage for care at every step, the fertility journey is a very interesting one, very complex it was, and we're making it much simpler. This will hopefully reduce the number of couples who ultimately need to resort to IVF because challenges can be identified and addressed very early in the process. This is a new benefit. This is a benefit that so many people have called me about. I mean, it's incredible. Oz and Bobby, I can tell you, we speak about it a lot. So many people have called me about we have to do this. They've been waiting for it for a long time. But this is a new benefit or an option that will be a major help for millions of American moms that will result in more beautiful American babies. We like that. To further reduce the cost of fertility care, my administration has negotiated unprecedented most favored nation agreements with all of the world's leading pharmaceutical companies and nations. You think that was easy? That was not easy. The nations in particular, I tell you. I did challenge them with tariffs. You don't want to give us what you want? I'm putting tariffs on your nation. Sir, we'll give it to you immediately. It was actually, you think Biden could do that? I don't think so. Nor did he try, Bobby, right? They didn't even try.
He did not.
They never tried anything. One drug commonly used in IVF has gone from, as an example, $966 to $168, a difference of 500%. This is the most incredible thing. It's not talked about by the fake news. It's sad because it's the biggest thing to happen, I think. We're getting drug prices, prescription drug prices down by 400-500%. Or depending on the way you want to phrase the question, you could say 400, 500, 600% Oz, and you could also say 80%, 70%, et cetera. It all depends on the way you phrase the question. I like the 500 better. And since we launched that website just a few months ago, it's called TrumpRx.gov. It's through the roof. Is that a correct statement, Oz? And by the way, you tell them that was your idea to call it Trump. It wasn't mine.
The president did not propose that name, but everyone else thought it was a great idea. It is working spectacularly well, incredibly effective at so many things. That there's not an American around buying a medication who should not check TrumpRx.gov first. We propose, Mr. President, it's going to save us $600 billion over the next decade, the kinds of savings we're going to achieve from the most favored nation drug pricing that Secretary Kennedy organized.
And the media doesn't write about it. If a Democrat proposed it, it'd be front page news every day for the rest of your life. The media, they don't want to write about it. Think of it. We're reducing drug prices by 500, 600%, or 80%, or 75%. Anyway, it's all about the phrasing of the question. And the media doesn't write about it. It's amazing. It's so sad. It's so biased. And that's why the media, their approval rating went down just today, 12%. You're at 12%. That's why I got elected with 97% bad stories. I won in a landslide because you have no credibility. So I wish the media would write about it. It's probably the biggest story. Certainly it's got to be maybe the biggest story in medicine, if you think. I mean, where you get drug reduction prices of 60, 70, 80%. A pill that costs $10 in Germany costs in New York City costs $130, $140. Now the pill is going to go to $20 in Germany and $20 for us. So we're going to have the lowest prices anywhere in the world. And we can't get a story about it. They won't write it. It's the biggest medical story there is, and we cannot get a story about it. I think I'm going to ask Walmart for a little help if they don't mind. Because you people seem to get very good. You get very good publicity. I think if you could explain the trick, then let me know. But since we launched the website just a few months ago, over 19,000 Americans have used those fertility medicines and discounts and saved more than $15 million just in a short period of time, a matter of weeks. The Council of Economic Advisors projects that the number will rise to $4.6 billion over a fairly small number of years. Nobody's ever seen anything like this. And we had to get the countries. First, we had to get the companies. And the companies were pretty good, but they knew I couldn't get the countries. So they didn't care that much. I think when we got the countries, I think they said, what's going on? And yet, they've done fine. They do more business, and they do it from, they made it up in volume, right? They made it up in volume, as the old story went. There are many other ways our administration is supporting moms and women. We passed the largest working family tax cuts in American history. By far, we passed the largest tax cuts, not only for women, for everybody, but for women. So many working women. We passed the largest tax cuts in history. We also made a historic investment in rural health with $50 billion distributed across all 50 states, and that gives each state a lot of money. Over the next 5 years, $10 billion has already been distributed, and you see the results all over the rural part of the United States, which I'm proud to say I won by about 80% of the vote. And many states are investing in improving maternal health care. Every Democrat in Congress voted against this historic funding. The Democrats, well, they suffer from Trump derangement syndrome, to be honest. They don't even know what they're looking at. They can't even see straight. But I have a new way out. I'm going to propose something the opposite of what I want, and we will have massive amounts of legislation. No, just all I have to do is say, we will not build the wall. And they'll as it
Diabolically clever.
No, I'm going to do it, Katie. We'll put it in.
I think you're
I'm going to go the opposite. Whatever is bad, I'm going to go for it, and they'll approve what's good, finally. No, they've got serious Trump derangement syndrome, which actually is a disease. I'm hearing it is actually a disease. It's an honor. Today, we're also enacting groundbreaking child care reforms to improve federal child care programs, including Head Start and Child Care Development Fund that goes to each state. It's big stuff. These reforms will give states more flexible, lower costs, increase options, and empower parents to choose what care works best for them. There's a lot of options that you're going to have. Under this plan, you have, I think, pretty much maximum, Heidi, I think maximum options. And that's what we're looking for, maximum options at the lowest cost. And you've got a cost that if you were here a year ago, or if you were here like during the last administration, you're talking about a cost that would be 8 to 10 times more expensive than what we're doing. And same exact prescription, same exact medicine, same care at 10%. It'll also free up child care funding for hundreds of thousands of additional children to support stay-at-home parents. In recognition of this ambitious agenda to support American mothers, today we're announcing a new website that is online right now. It's moms.gov. Moms.gov. You couldn't have put that in the Trump deal. You had to give me a new one, competition. This guy, he wants to make me work so hard. So explain moms.gov, would you please, Dr. Rouse?
Well, we're going to have a whole discussion about it, sir, a little bit later. If we could, we want Katie to speak a bit about the first issue you mentioned. But moms.gov is a beautiful site. Folks ought to check it right now while we're talking.
Yeah, you really should, and it's pretty incredible. Something that Senator Rubio and I tried to do, sir, but you're the one who actually did it, along with.
Well, I like TrumpRx.gov.
I feel like that.
No,
I mean, I love moms. I love moms, but I like TrumpRx.gov. You put me in there, I got to make sure it gives me competition now. You want it to work? That's all right. We're only kidding. I have to say we're kidding, otherwise they'll do. Trump and us had a major dispute. It was terrible. And Bobby broke him up. It was a terrible, terrible dispute. These people.